Okay, great, everyone. Thank you, and welcome to the STS Intermacs Dashboard Training webinar. Today's Thursday, October 28th. It's kind of a gloomy day, cloudy day here in Birmingham, Alabama, and so let us know where y'all are from in the chat. But welcome to the dashboard training. We have the lead directors from the Intermacs Data Warehouse here to take us through the dashboard and show us how this new exciting tool works. Before we get started, I just wanted to introduce the team. We have Dr. Ryan Cantor, who's the Director of Reporting and Lead Statistician at the Intermacs Data Warehouse. Dr. Rudu Raju, who's the Director of Programming at the Intermacs Data Warehouse. He is one that's responsible, him and Ryan and others, for working on this marvelous dashboard, the outcome analytics tool, and Rama also directs and is responsible for all that, our beautiful and wonderful working database we have, him and his team. We have Mrs. Patricia Potter, who's the quality informatics nurse for Intermacs at UAB. Along with, we have Dr. James Kirkland, who's the director of the Intermacs Data Warehouse at UAB. And from STS, I want to say thank you to Carol Crone, who is our senior database manager of all the databases. And if Leanne's on the phone, hey Leanne, thank you for all your help. And she's the national database manager for congenital heart surgery and general thoracic surgery databases. So just a couple of things to overview before we get started. Just want to tell you again, thank you for joining today. This is really exciting. It's exciting for STS. I'm excited for all the users to be able to experience this tool. Also want to say a big thank you for those that attended AQO 2021. It was a really good meeting. We've had some positive feedback, and thank you. And you can still, if you were not able to attend, you can go to the STS homepage and search AQO, and you can find out where you can review the on-demand content and presentations from the day. Just want to, one other announcement. Again, just a reminder, the new updated adverse events will go live in the database on this Friday, October 29th, so tomorrow. The data collection forms and the Appendix A, the adverse event definitions, will all be posted in the appendices for Intermacs. And we're working on getting the user's guide and the training manual updated as well. So thank you everyone for joining. And Rama, if you would like to, I'd like to introduce Dr. Rama Radharutu, who again will take us through this overview of the Intermacs dashboard. And also I'm gonna quickly stop my share so he can get his screen up. But I want to let everyone know that please put your questions and answers or your questions in the Q&A box here and not in the chat. And Rama?
Yeah. Thanks, Catherine. I was wondering, I don't know if Dr. Kirkland can make a few comments, and then we can get started looking at the, I will pull up just the first slide, but yeah.
Yeah, it'd be great.
Sure, I'd be happy to. So the purpose of this effort is the keen interest of the Society of Thoracic Surgeons in promoting quality. And of course, quality of data entry is something that you all are very familiar with, but we want to extend quality of data entry to another level in which we can allow you to look at your own performance. And that relates to performance in terms of volume, as well as determination of the profile of your patient population and certain outcomes. And the really amazing thing about what Ram is going to present today, if you look at all of the material that you get on the quality assurance reports, the quarterly reports, and all of the minor requests that we receive, With this tool, you will be able to basically view within your own institution all of those details in the quarterly report and those comparisons, and you can do it at any moment in time that you wish. And those details will be updated almost to the day in some instances, and otherwise to the time of the nearest research build. So basically what Rama is going to do is going to take you through this incredible way in which you can define a cohort within your institution, anything that you would like, then compare it to another cohort within your institution, or compare it to Intermacs as a whole. So I hope you will find this extremely useful every day, every week, when you're generating reports, when you're answering quality assurance questions to your administrators and to each other. So with that, I'll turn it over to Rama to further demonstrate this really exciting tool.
Thank you so much, Dr. Kirkland. Okay, so with that background, so just a few details before we go into the demos. So the dashboard will be available on the main Intermacs website, and then it's added to the main navigation. So it's right next to the home screen, home button on the main navigation. And for access, all users at all active sites in Intermacs will get access to the dashboard. And for the purposes of this demo, we prepared a Hospital X, which contains patients selected randomly from different hospitals. So these are there's no PHI involved. So again, before we look at the main tool, this is just the layout of how the dashboard looks in general looks like. So at the top, we'll see some sections, which again are the different displays are organized into these different sections. And then next we have the filters, where this will help in if we want to drill down by age group, gender, race, device type, patient profile, or device strategy. We can select these filters, and all the data below, all the plots below will reflect based on these selections in these filters. And next we have a legend for the hospital. So if I'm at Hospital X, again, that is the demo hospital we are using today. So my hospital will show in blue, and then overall Intermacs will show in gray. And then following that, we have all the plots. So we have a series of plots. Here we see age group, but based on which screen, which section we are in, we'll see different plots down at the bottom here. We'll go into more detail, but this is just the general layout. And now a more closer look at the different sections that are available. We can divide this, put these sections into 4 different boxes. The first one is reported events that gives a summary of all the reported events. And the next section is about patient characteristics. The next 3 sections are showing 30-day adverse event percentages. And then the final 2 sections are showing the metrics. So these are the 4 main boxes in which we can categorize the overall sections. So now let's look at the first section, which is the reported events. So why we developed this is to provide a snapshot of what is happening at your hospital, and then to make sure that all the data is accounted for. So this provides a simple table and simple summary of the data entered at the hospital. So what it is an accounting of events entered at your site in each calendar quarter. So for example, if I reported 3 infection events occurring in January 2021, then they'll show up under a column 2021 quarter 1. So it is, so the events are counted by, so everything is counted by event date. So infections, everything is counted by the event date. So for example, if you're counting the infections, they're counted by the infection date. The data set for this display is updated nightly. Now, before we get into the demo, for this, we'll consider these 2 scenarios. So I'm a user at the hospital, and then I want to see the number of Intermacs patients at my hospital in the last 4 quarters. So that is my first question. And the second question, I want to see the number of infections entered at my hospital. So let's see if I can look at the dashboard and get an answer to both of these questions. So again, the dashboard is available on the main navigation here. So it's available right next to the home screen. So if I click on this, I'll see a disclaimer that talks about not using this for research and other terms and conditions. You can go through that and then click on, once you click on I agree, the dashboard opens up. So here is the first display on the dashboard. So we're talking about the first tab, which is reported events. So we show a table here. And so going back to my first question, I want to see the number of patients in the last 4 quarters at my hospital. So there's an active patient row that shows that there were 26, 31, 32, and 31 patients respectively in the last 4 quarters. So that is the active patient. If you want to see how we got this number and the formula behind it, we can hover over this icon, bulb icon that shows. So this is the total count of Intermacs patients on a device at this site. And then I can see the number of new patients in the last 4 quarters. Again, this row shows the number of new patients. And again, we can see the calculation here, like how this is calculated. And we can also see the number of implants in the last 4 quarters, number of bleeding events entered, number of infections so number of patients with infection in these 4 quarters, device malfunction, and death. Notice that some of these are empty because again, this is a random hospital, a hospital with randomly selected patients. So this is for a real for an actual hospital. All of these, most of these columns should have a value. So that is the first. So the first question answered, and the second question is answered. So I know how many infections are entered at my site in the last 4 quarters. So with those 2 questions answered, that is a summary about the first tab. Now let's go to the next section, which is patient characteristics by implant quarter. So the reason why we have this is to provide a visual summary of the patient characteristics and also be able to compare site versus Intermacs, and to also be able to look at trends over time. This section provides an accounting of patient characteristics in each calendar quarter. So a scenario for this is if I enter 3 patients whose first implant date falls in January 2021, then they'll show up under 2021 Q1. So their implant date, the first implant date should fall within that quarter, then they're counted towards that quarter. So the last display we saw was counted by event date, whereas everything going forward will be counted by the patient's first implant date. And for the data source, we update the data source for this display monthly. Again, before we go into the demo, I'm a user at a hospital. I have these 2 questions. So I want to see if my hospital is doing more destination therapy when compared to Intermacs. So that is my first question. And the second question is I want to see the trends for destination therapy patients at my hospital. So with those questions, let's go to the demo. So in the dashboard, I'll click on the patient characteristics section. And this is how it'll look like. So again, we have all the filters, and we can drill down and select any of these filters to see data and summary about all these plots about that particular cohort of patients. So we have all these filters available. And if you notice, all the displays plots here are related to these filter groups. So we first have age groups. And then for age groups, within each quarter, they're broken down by 19 to 39 year, and then all these different age groups. And then as we saw earlier, so my hospital is in blue, Intermacs is in gray. And we can see that at my hospital, 19 to 39 years is 14.3% in 2020 quarter four, whereas in overall Intermacs, it is 12%. So these charts are interactive, so we can hover over them and then see all these more details about each of these numbers. So again, in 40 to 59 in 2020 quarter four, we had 6 patients, and that accounts for 42.9% at my site, whereas in Intermacs, it's 250 patients, and then it accounts for 39%. So we can see the different trends here. And same thing for gender, and here are all the sections in gender, all this specific breakdown of gender, and then the race, device type, patient profile, and device strategy. Now, when we get here, so going back to my question, so I want to know what are the trends if my hospital is doing more destination therapy than Intermacs. So for that, we can see that destination therapy at my hospital was 71% in 2020 quarter four, whereas in Intermacs it was 76.7. But in 2021 quarter one, it went up to 85%, whereas Intermacs stayed almost the same at 77. And then it went even higher in 2021 quarter two, which to 92%, whereas Intermacs again is almost the same. And 2021 quarter three is 100%. You see that the number of patients for this quarter are low. That is because this quarter currently only has data until July, because this is still ongoing. So so the numbers in this last quarter will always be lower, depending on when we are exactly looking at this dashboard. So with that, we can clearly see that my site is doing more destination therapy patients over time. So I can see that trend clearly. And so that answers my first question. Now, going back to the second question, I want to see if some trends just for destination therapy patients. So for that, I want to see only destination therapy patients. So I'll deselect all, and then I'll select destination therapy only. And almost instantly, all of this information gets updated. And now everything we are seeing in this displays are just about DT patients. So age groups now went down to 20%, 90 to 39 years went down to 30%. So all of this information here now is only showing about DT patients. So now I can look at any of these, and then if I'm looking for a specific trend for DT patients, I can see that here. And similar to that, we can also select any of the other filters based on the type of question we have and see the data and plots about just that specific cohort. Okay, so with those two questions answered, let's go back and to the next section. So the next section after patient characteristics, the next 3 sections have displays about 30-day adverse event percentages. So again, the reason why we have this is to provide a visual summary of specific adverse event trends, and also be able to compare these trends between my site versus Intermacs. So this section has percentage of patients that experience a certain adverse event within 30 days. So if I reported 3 stroke events on patients that had their first implant in Jan 2021, and that stroke happened within 30 days, then they'll show up under 2021 quarter one. So there has 2 conditions that have to be met for the patients to be counted. Their first implant date should fall within that quarter, and the outcome should occur within 30 days. Then they're counted towards that quarter. Again, the count here is by first implant date and not by the event date. So again, the data source for this is again updated monthly. So to explore these 3 sections, let's again, I'm a user at a hospital. I want to see if the mortality percentage for, again, in the last scenario, we saw that my hospital is doing more DT patients. So let's see. So now I want to see the mortality percentage of DT patients at my hospital. So that is the first question. And then second, I want to compare the stroke percentage for DT patients at my hospital compared to overall Intermacs. So with those two questions, let's go to the dashboard. So here, the next three sections, 30-day mortality, 30-day major infection, and 30-day stroke, all of these three are about 30-day adverse event percentages. So to find an answer to my first question, the mortality trends for DT patients, so we go to this 30-day mortality section, and notice that since we selected destination therapy filter on the patient characteristics, that selection will carry over here. So we don't have to make that selection again. So that's carried over to all tabs which have filters. So now we look at the DT patient, destination therapy patients. Now I want to see what is the 30-day mortality patient percent. So the information is provided as in the tabular form and also as a plot here. So for the tabular form, we saw, so in the tabular form for my hospital, I want to see 30-day mortality percent for my hospital is 40% in 2020 Q4. And then it came down to 0 and then went up to 8.3 here. And then here in the most recent quarter, it's again at 0. As I said earlier, this is only data until July. So this can still keep changing. So we can mainly look at these 3 quarters for trends. So I can clearly see that the blue line again indicates my hospital. So I can see for some reason in 2020 Q4, the mortality percentage was very high. It came down to 0% in 2021 Q1. It went slightly higher again in 2021 Q2, and then it's low in the current quarter. So I can see that trend clearly and also compare that trend with Intermacs. In Intermacs, the 30-day mortality percentage is almost close to 8%, and it's almost stays within that 8 to 5% within that range. So we can see that trend here. So that answers my first question about mortality for DT patients. And if for whatever reason, if I want to see mortality for all patients, then I can just go back and select all, and notice that now, so for DT patients, it was 40%. Now it came down to 28.6. And then it's almost close to 7.7 and 7.7 here. So I can see that trend also here. So it's close to Intermacs trends in these 2 quarters, but for whatever reason in this quarter, it was higher. So I can see those trends. So now let's, okay, so that answers my first question about mortality. Now let's go to stroke. So the second question was about looking at stroke and comparing stroke to Intermacs. So this is again for all patients. So let's first focus on the DT patients. So I'll deselect this and select just DT patients. And for DT patients, the stroke at my hospital is 20% in 2020 Q4, went down to 9%, and it was 0% in 2021 Q2, and then current quarter, it is 0%. So again, I can see the same information in this depicted in this line here. And for Intermacs, it is almost stays almost constant at around 4 to 5%. So this is constant here. So that is for the DT patients. Now, again, we can look at these icons here and see the formulas behind all of these rows. So if you want to see what this total 30-day follow-up days mean, then we can actually look at this description to see what exactly that is. And then similarly for 30-day stroke rate, we can see this description, the formula that goes behind this. We have taken a lot of care to make all of these numbers and displays very accurate. So and by having these displays here and formulas here, we wanted to make those calculations transparent to you. And so that is the DT patients, stroke for DT patients. And again, I can select all to see the trends for all patients. So you see that the 30-day stroke percent is actually higher at my hospital for some reason than overall Intermacs. So it is 14% here, and then it is 15, close to 15% here, and then drops down in the third quarter. So that could give us something to examine or look deeper, or look at it further. So, and the 30-day major infection is similar to what we saw in stroke and mortality. So it's the same table information and then the plots down below. So with those questions answered, so that is a summary of the 30-day adverse event percentages. Now going to the last two sections, which is metrics. So the metric section, we wanted to provide a visual summary of the calculated outcomes trending over time, and also be able to compare those outcomes between site versus Intermacs. So what this is it's a post-op. So we have currently for the metrics, we have post-op length of stay for patients discharged on a device. So there are two comparison groups here. First, we compare patients at the site compared to aggregate of all patients in Intermacs. So this is, if I want to know the length of stay at my site compared to overall Intermacs, we can look at the first section. Whereas the second section talks about comparing the metric at the site to the same metric calculated at other sites. So if I want to know what is the 75th percentile for length of stay, what is the 90th percentile for length of stay among all Intermacs sites, I can use that second section. So that's what these two are. And then for the details, again, this data source for these displays is also updated monthly. So again, before we go into this demo, let's consider that I have this question. I want to look at the trends again, because we're doing more DD patients at my hospital. I want to focus on that. I want to look at trends for length of stay for DT patients at my hospital. And then for the length of stay overall, I want to find the 25th, 75th, 90th percentile for length of stay at all sites in Intermacs, and see where my site stands. And then, so this is a way to benchmark my site's length of stay versus other Intermacs sites. And then also, I want to see if the length of stay percentiles are changing in all Intermacs sites for critical cardiogenic shock patients. So let's look at these questions. So to answer these questions, let's go here. And then for that, we can look at the last two sections here. So for the first question, I want to see the trends for length of stay at my hospital for destination therapy patients. So let's select only DT. And then we saw that now median gives a good idea about where the overall data is. So at my hospital, the median for 2020 Q4 is 20.5, and it stays almost the same in 2020 in the next quarter, and in the 2021 Q2 it went slightly higher to 22. So that gives an idea of the trends of the length of stay for DT patients, whereas for Intermacs it is again almost the same. So the median is at 20. So we're close to the median for all when we consider all Intermacs sites. So this chart here depicts the same information for median. So we're showing that at my site it is upper quartile, lower quartile, but the actual so the actual value for this is 21, and then for Intermacs it's slightly higher. So we see that here. So that is answering the first question. So now if we go to the length of stay, so now the next section. So in this section, in the last section, we provide a box plot that summarizes the length of stay, and then provides benchmarking to compare my site versus all sites. So I can see that my sites, for all patients, considering all patients, my sites destination, so length of stay is at 19.5. And then this box plot shows a distribution of the length of stay for all other sites in Intermacs. And we can see that the 90th percentile is at 41. is at 41. So the 90th percentile here is at 41. And then the 90th percentile is close to 33.5. And then my site is at, again, 19.5. And then the median is at 21. And then the lower hinge is 17, and the lower whisker is almost at 10. So that gives gives an idea about the distribution of length of stay for all Intermacs sites. And we can see that there are some outliers here. So this plot summarizes all of that. And then now I can apply any of these filters. So I can say I want to see just TT patients. So this length of stay is almost the same at 21, and the distribution is did not change much for all Intermacs. And the plot down here provides separate for each quarters, like a separate box plot for each quarters. Whereas this display is all quarters added up together. This is just breaking it down by quarters. So the same information broken down by each quarter. And then now to answer my second question, I want to see if so for all patients, the length of stay is at 19.5, and then the 90th percentile is at 33.5. Now, I'm curious to see if I select only critical cardiogenic shock patients. Let's see how this. So you see that box plot definitely changed a lot. For my site, the length of stay is still 20. So that did not change. But for overall Intermacs, all of this changed a lot. So 90th percentile from 33, it went up to 48 days, which is a lot. So we can see that there's a clear change for, so we know that these are sicker patients. So it makes sense that the length of stay is higher for those patients. So similar to that, we can apply any of the filters here by age groups. So older patients, we can look at that, or by gender, or any of these filters we can apply to see how the trends are changing and how they'll affect the overall length of stay. So that is the full demo showing each tab in the dashboard. So with those questions answered for me, now after that, we can also download the dashboard as PDF and PowerPoint. We were looking at, so we resolved the issues that we were having with the display while downloading it as PDF. So it should be working without any problems. So let me show you that. So I can scroll down here, and then I can hit download. I have an option to download it as PDF, as an image, PDF or PowerPoint. Image again might be harder with all the resolutions, but PDF and PowerPoint should work reasonably well. And there's also an option for crosstab, which is like the actual data source behind each of these, but we'll get to that. So let me try PDF, and then it'll ask include this view, or we can say this view, and then scaling. It's better to leave scaling at automatic so that it does not try to zoom in or zoom out anywhere. And then all of this is fine. So I'll download. So here I can see all the tabs, and then each of the everything here. Oh, okay. Looks like, let's see, we can try downloading. Let's see if there should be an option for PDF. Okay. Oh yeah. So this view only downloads the current view, but if we want to select all of them, then we can select this and then say select all. So that'll select all of the workbook. Okay, so if I select workbook and then select all of them and then say scaling is automatic and download. So now it is processing all of them. Okay, so now I can see each display here, a PDF with each of the displays and the filters applied, and then showing all of those displayed in a PDF format. So I can also do this in PowerPoint. So one more option is to just download that as a PowerPoint, so we can also do that. So those are the export options. And again, this was possible with a lot of hard work from amazing team members from Curso. I think Ryan Cantor and Shafiq are in this meeting. So everybody, so we like all of them were like worked really hard to get this, make this possible, and also we got like really good feedback and direction from Catherine, Keisha, and Sheena, really helping us focus on the priorities. So many thanks to them. And to conclude, again, this is the first version of the dashboard. We are actively collecting feedback for developing the next version. So if you feel that any displays or AE percentages or metrics that will be useful to you, please send us our way. We'll add that to the future requests. And then also we are working on a survey that we'll send out and include that in on the dashboard tool, so that we can collect actual feedback from the survey. So with that, thank you so much for the opportunity to present and show this tool. I think we can, back to you, Catherine. Thank you.
Yeah, thank you, Rama. Thank you so much. And that was a great overview and demonstration of how to use it. Dr. Kirkland, is there anything that you would like to add since he's done his overview? What you had said earlier.
Yeah, I'd just like to reiterate, Catherine, how flexible this tool is. You know, when Rama goes through it, it's almost, despite the elegance of his presentation, is really overwhelming, the amount of flexibility. So I think that what's most important is for the coordinators and other members of the team use this application and think about ways that you find it useful and ways that you think it could be improved, and provide us feedback. So I think this is a good segue, Catherine, into some of the questions I see. So
Absolutely.
maybe we can start with those.
Sure. And I do want to mention right before we get to the questions, as Rama mentioned, the dashboard will be upgraded. So we will be adding new features to it. So we're happy to take any suggestions. You can email myself or Patricia Potter if you have any suggestions. But we'll go now with the questions. The first question's from Carol. When does this go live? This will go live on Monday, November 1st. And like Rama said, you'll log into the Intermacs database, and then you'll see a tab up top, you know, where you click on the reporting tab, the reports tab. To your left, there will be a dashboard tab. So I'm hoping everyone does find it useful. And I believe Rama had mentioned this. I'm going to reiterate it. You can log in every day and get the overview at your site. It'll give you a snapshot of patient counts and events entered. So, and that's the first thing that's displayed when you do log in. We do have a question from Melissa, who says, this is great. We have some members of our clinical leadership team who may want to access these dashboards, but we do not want to change the physician representative, site admin, billing contact, or contract contact. Data entry coordinator also seems like the wrong description. Is there a consideration of adding a role, maybe a backup site admin or some role with functionality similar to the data quality recipient for ACSD, GTSD, or CHSD? We have co-medical directors and a clinical service line director who receive key information but aren't involved in day-to-day management of the registry process. Sure, Melissa, they're actually, if you look on our participant contact form on the STS database participant contact form, you will see we actually do have an option as a backup site administrator. There is also, you can have a co-physician representative, and there also is an other text box, and you will see the participant contact form has been updated for dashboard privileges. So like Rama said, everyone will have access to it, but we've heard from some sites already during the beta testing and developing of this tool that, not all sites want all users to be able to use the dashboard. So there, that's kind of the opposite of what you're saying, but of what you're asking. But yes, if you look at that participant contact form, you'll absolutely find out what you're looking for. Thanks.
And Catherine, is it correct to say that the site can decide who they want to have access to this, and then they just use that form that you're referring to indicate the people?
Correct. Yes. Yes, they can. They'll just have to complete and submit the form, and then we will, we'll generate the login and the appropriate credentials from that. So absolutely. I know that this was a lot of information, and it is a new tool, and I know that there's a lot of new exciting tools and data fields that are being added in the next few days, and it's a lot. But so like I mentioned earlier, we will have another webinar. We'll probably wait a couple of weeks and let everyone kind of see it and look at it and use it some, and then I think at that next webinar perhaps we'll have more questions. But we have one more. Tiandra asked, I appreciate the option to access data in real time versus waiting for the quarterly reports. Would there be options to view additional adverse events with the next rollout? Our team is also interested in comparing our site to like-size programs that participate. Will that be an option in the future? And when do you anticipate the next update? So the first question I will take, Dr. Kirkland, I think I will let you take the comparing the like size, but
Sure.
I'll go ahead and ask her first question. More options to view additional adverse events with the next rollout. I believe so, Rama. I know that's something we were looking at,
Yeah.
to look at things like renal dysfunction or respiratory failure.
Bleeding and others. Yes, they are part of the, yes.
Yes, so definitely we'll be adding to that. And that should, the next update, I think possibly by the end of the year, Rama, or maybe first quarter of 2022.
Yeah, I think around the first quarter of 2020, 2022.
Okay.
So I think,
Sounds
yeah,
good.
again, like once we do the survey and collect the feedback and digest all that, and we can plan the next update. Sure. Yes.
Absolutely.
Yeah.
And then Dr. Kirkland, if you'd mind addressing the issue with comparing.
So Tiandra, your interest in the adverse events, and we would say absolutely. And we in general just list the major adverse events that we collect in the Intermacs, and then Catherine and others have prioritized what they wanted to see first. But our full intent is for you to take any of the major adverse events, any important adverse events that are clear from the data entry forms. And then Rama and his colleagues will simply do the exact same thing that they've done for major infection and stroke that they've done so far. So all of the major adverse events will be available to you. It's just as soon as we get the programming to roll them out. So you ask a very important question about like-sized. And there might be, if while I'm talking, if you have another reason for asking this, just type it in and I'll try and address it. But imagine this, that if I'm a center, and let's just say if I'm like size means I have a fewer number of implants than the busiest centers, and I want to compare myself to centers that are more like me. Now, first of all, let me tell you the downside of that, and then tell you what we are doing instead of that. If you said, let's say I do 10 implants a year, just for example, and I want to compare myself to all other sites that do 10. Well, the danger we run in is that if you were in that category and there were only 3 centers in the United States, for example, and some type of query that you might make to define like size, you might have close to information about a specific center. If there were only 2, for example, that were in that group of, depending on how you define like-sized, that might give away too much information about the local, about individual sites. So we have elected not to do that, just because if we put out like-sized, it would mean you could choose from a menu and define like-sized and so on. So I think more importantly, we are going to give you the opportunity to define the cohorts. So for example, if you mean by like size, well, we do a whole bunch of DT, or we do no DT, or we do all elderly patients, or we do a lot of Intermacs profiles 1 and 2. Well, this tool is perfectly designed for you to do exactly that. So you can define your cohort that defines the kinds of patients that you implant in your institution by selecting from the menu. And then you can get a direct comparison within that cohort of how you are doing compared to the rest of Intermacs within those specific cohorts. So why don't you work on that for a while and try that out and see if that satisfies your needs. If you'd like other definitions of like size that are other than center volume, then let us know and we can try and work that out.
Thank you, Dr. Kirkland.
And notice also when Rama was talking about the center comparison, that's where you can, when you look at the 10th, 25th, 50th, 75th, and 90th percentiles and see where do we sit among other centers. See, that's where you would have the great opportunity to define your cohort, and then then you can look at a hospital level. Now, Rama, maybe we can just take just a minute, since we have a few minutes left. Help us understand a little bit more about the center comparisons. Now, do you have the ability when you're comparing your center to define, do anything in defining cohorts and then look at center experience within given cohorts?
So looking at other cohorts,
let's say if you said destination therapy, and I wanted to look at it at when you're set a center level.
So destination therapy. So other centers that are similar to my destination therapy outcomes, like destination therapy numbers.
When you compare, where do I live on this 50th percentile, 25th, 50th, 70th, etc.
Yeah. Okay. Let's look at that. Okay. So on this we could. So this is again comparing. Like this is a depiction of like the distribution of all centers. So if I only look at destination therapy, so this is again, this is only considering destination therapy patients. Here is the distribution of length of stay for DT patients. So, and it'll be same when we apply any of these cohorts or filters. This is only this is showing the depiction for length of stay between all the centers.
Okay, so look at select patient profiles 1 and 2, and all strategies, but profiles 1 and 2.
Yeah. So
Tiandra, I don't know if this helps you, but see, this is really incredibly powerful. So when you say liked size, if you say, well, I want to look at centers that do, between 5 and 15 implants per year, that's one way. But remember, in any kind of a quality assurance look by, whether it be, Joint Commission or public reporting, etc., what they are likely to do is not to say, well, we're going to look at centers that just do 10 implants. What this will allow you to do, though, instead is you pick the cohort, just as Rama has done, and then within that cohort, it will select, and Rama, correct me if I'm mistaken, it will look at that cohort in all centers that have patients in that cohort, And then it will compare, like this will be, it'll look at all profiles 1 and 2 throughout Intermacs, look at those within each center, and then give you the average, the mean length of stay in those compared to your experience at your center within patient profiles 1 and 2. Is that correct?
Yeah, yeah, that is correct. Yes.
So that is, to me, that's, that does not at all allow anybody to begin to identify a particular institution, but really gives you actually more meaningful data. That is to say, if I do more high-risk patients or low-risk patients or younger or older age, within those groups, how do I compare with other groups? So at least I think that's a good start. And Catherine, would you mind commenting about Tiandra's comment, a slide presented the AQO that showed comparison of like sized?
Yes, I was gonna actually, Tandra, if you could, not for sure, like size. I'm not for sure what presentation that was in, because I don't believe it was Rama's, but, if you could email me more details, and I can get back to you on that.
Okay.
But I don't see any more questions and answers, but thank you so much, Dr. Kirkland. Oh, here's one that slid in.
Center level outcomes.
Yeah. Oh, I think that may be was it Dr. Calger's presentation possibly?
And Tiandra, could you just type in there, are you talking literally about volume of implants per year?
We could unmute Chandra if that would be helpful.
Yeah, that'd be great.
Okay, that way we can. If you're able to unmute.
Yeah, Tiandra, are you able to talk about that? Tiandra? Okay. Well, if she's, I hope.
Oh, she doesn't have a mic. Okay. Well, you could just type in there whether you were referring to volume. So I don't, Catherine, do you remember Jennifer Calver's, I guess in her presentation, she was talking about low, medium, and high volume centers?
Yes, it was.
Yeah.
I believe it was. So that's where she got it from, was Dr. Calger's presentation. Yeah.
So, I think this is the kind of thing that I don't know if they do this.
Oh, she said it showed a comparison of adverse events, strokes, GI bleeds, driveline infections, and etc.
Compared by center volume. So
it was like your site versus Intermacs.
Yeah. So, Rama, I think let's just consider for a moment if Catherine and her STS colleagues thought it was useful to define a low, medium, and high risk, high volume centers. If that was deemed, if there were broad enough categories that you would not be able to identify specific centers. And Catherine, if you thought that was appropriate, certainly we have, Rama and his colleagues have the capability of saying, we'll look at the previous year or previous 2 years, however you want to define it, and look at the number of implants in that year total, and then insert that number to define a cohort.
Yeah.
In other words, you'd have another category, center volume.
Correct.
Okay.
And then you'd simply select that. And that could be just another area of selection. Isn't that correct, Rama?
Yeah, that is correct. Yes, we can do that.
I'll definitely, Carol, you and I can talk about this offline. So, and I'll get back to you, Dr. Kirkland, and your team.
Sure. This would be this is all a matter of what STS feels comfortable with in terms of protecting institutional identity. But if that were approved, that is, Tiana, that is not a problem for us to program.
And yeah. Yeah, and
Okay.
also I just wanted to quickly mention that based on the beta testing, what we found out is the tool that we're using does not work on Internet Explorer 11. So it's Internet Explorer 11, IE 11 is an old browser that is going out of support next year in July. So it works in all the recent newer browsers, but if you're still using IE 11, you might have to upgrade to a newer browser to use this tool.
Yeah, thank you for that reminder, Rama.
Yeah.
Appreciate it. Well, I just want to say thank you again to Dr. Kirkland and your amazing team at UAB. I just want to reiterate, because I just received a message. Someone asked where they could find this on the IQVIA dashboard. Just want to say Intermacs, STS Intermacs database is not associated with IQVIA. It's the Intermacs data warehouse is housed at the University of Alabama in Birmingham. And they work for CURSO, which is the Kirkland Institute of Research Surgical Outcomes. So this has been done by UAB in the Intermacs data warehouse, not IQVIA. So you will find this when you log on to the Intermacs, to your Intermacs database. So I just wanted to put that out there. But thank you everyone for joining. Again, be on the lookout. We'll send some communication about the next webinar. Again, if you have any questions or suggestions in the meantime, or after next Monday when you're working on it, you can send those to Patricia or I. And thank you again for joining, and I hope everyone has a good day. And thanks again, UAB, for your great work. Thank you.
Thanks, Catherine.
Thanks you, Catherine.
Thank you. Everyone have a good day.
Yeah.
Bye-bye.